Hey guys, we are back in the office, end of the day, and we are injecting one of the newest fillers in the United States. I want to show it to you. It's cute, and it's a smooth gel called Versa, and you can see that here. And it comes in an amazing box, and we're excited about injecting it because it's the only filler in the United States that's actually prehydrated, meaning that what you see should be what you get, because most fillers that are hyaluronic acid based, they hold water. And as the new technologies have come out, they've held less and less water because of the cross-linking. But this technology is special because it's already prehydrated, meaning that you're basically going to get what you see. And if you inject using a cannula, you're less likely to swell, meaning we may actually see the ultimate outcome right now. And that's what we're going to do today with our beautiful celebrity who's here today.
Hi, I'm Ashley.
She's gorgeous. And,
Thank you.
And basically,
It's super red right now.
And what's important is, the reason I brought Ash is because she's already beautiful.
No.
You don't want to use a lot of filler on her. Our goal is just enhancement, so I call it dabs or baby injections. We're just going to do very small amounts to enhance her signature features, which are her beautiful elongated mouth, elevated cheekbone, and elevated and contoured jawline. So we're going to have her turn for a sec, and what I'm going to do is I like to give our younger girls a more cat eye look, a little more pull and tightening.
I love a cat eye.
Perfect, in the lateral part of the cheek. So we're going to use a cannula through one injection point, and we're just going to go in really slow, a very, very, very subtle amount. And you guys can see here the gel is nice and smooth. Okay, go ahead and grab. Be really gentle. We're going high along the cheekbone by the eye, and we're just going to lightly inject some of the filler, very little. And why are we doing this area? Enhancement. Okay, most girls love how the contouring looks when they're in video, or they're doing Lumi selfies, or they're putting makeup on. So we're just doing a very small amount, okay? We don't want to make her look overly cheeky. We just want to lift. Do you have much pain or no?
Not all.
Beautiful. Okay, so you guys know that when you look at someone's face, this elevation right over here by the lateral part of the eye has a perfect area of shadowing, and that's why makeup artists know how to make that enhanced. And we're going to use a little filler here along the bone and through her cheek fat pads to do that same type of thing. Okay, just to give her a subtle lift, and it will pull the eye a little laterally. Not using a lot, very little. Okay, we follow the angle of the mouth up to the temple. We don't want her to freak, so we're just doing very small amounts.
I would freak, so.
Okay, that's it. That's all we're gonna do.
Tiny amount.
Very little. Now, from there, we're gonna do a new spot. We're gonna come. Are you okay or no?
Am I okay?
Remember, we use the cannula, so the tissue gets lifted, so it's a little swollen from the cannula. We're not even halfway, not even a fraction done.
Oh, okay.
So give it a little time. We also want to give her some definition on her jaw. Now, some women like to have sort of a heart shape or rounder face. With her, we want to get this chiseled. She has the Sandra Bullock jaw. That's
Everybody compares me to her.
See, exactly. So what we want to do, I hope that's a good thing, is we want to just give her a little definition along this 90-degree angle here. So we just do a subtle bit right along the base of the jaw. What's cool is it doesn't really hurt, right?
No.
Good. Okay, it's a very safe plane. Is anyone asking questions or no?
Not the moment.
Not the moment?
Not the moment.
What's wrong with people? They're either mesmerized.
They're waving and giving hard eyes. So
they're either mesmerized or eating dinner. That's it.
we have somebody saying, "Wish they could be laying there."
Oh, see?
Man. Jelly.
Once in a lifetime. Where are you from, person that said that? You know.
What's the filler again?
This is, you want to say the name?
Yes, please.
How do you say the first part again?
Revanesse.
Yeah, Revanesse Versa. I'm not good with the long intro names. I like Versa. It's a very powerful single name. So you see here, we're able just to give her a little structure. Now what we're gonna go to the next syringe. Go ahead and alter that.
So how long will this filler last?
So that's a good question. I think up to a year, although, you know, when with sugar-based fillers and ones that are softer, they sometimes will go away a little bit sooner, 9 to 12 months per se. Now we're going to build up in this direction.
Gabby, the stylist, says thank you. She loves her results.
You're welcome.
There you
Good to see you. How is everything? Send some pictures our way. Okay, ready? Lay back.
Wait, I'm not ready.
Okay, well.
I think I look too filled here.
Well, I'm also did this motion. Give it a little time. It's 0.3.
Are you sure?
Pause it. I didn't even do anything here. Nothing's here. Only here. Just wait a couple minutes and we'll decide at the end.
Okay.
Okay? We can always do.
But
what we need to
I
do.
can see the jaw. I like the jaw.
Yeah. It's gonna come.
Also, your cheek is red from the numbing, so
it's
it
gonna
might be
honestly.
making it.
It's gonna be perfect. It's gonna be fine. We only do 0.3, but very little. Okay. So now we're gonna come up in lateral direction.
You're getting a lot of comments. Is she Emerata?
Oh, please.
Who is
Give me
that?
another. Give me
A
another
lot of people are saying, is that Emerata?
Who's that?
Stop.
Yeah.
Keep it
People.
coming, people.
You're getting a lot of compliments. There you go.
Emily Rodakowski.
I don't know who that is.
What?
Yeah, the she's in Gone Girl. The one Ben Affleck cheats on his wife.
Sorry.
I don't know.
Okay, hold on. In a different spot. Skin's too tight there.
Okay.
So we're gonna come back over here.
So what are we doing here?
We're gonna make the other angle. So we
Okay.
created the lower border.
Okay.
Now we're gonna create the angle on the side.
Okay.
You have a little allergy. That's why you're bulked up on the from the numbing. So FYI.
Oh, that's what I told Candace, that I get really
There we go.
puffy with the numbing.
Okay. So
When-
now we're gonna go back and along this angle of the jaw, we're gonna deposit just a depot amount of injection right along the angle here. This is so her jaw really pops when she's doing her photos and she's on TV, she has some makeup.
Is this a 29G PDO mono?
No.
Got me.
This is a cannula, not a thread. They're asking if it's a thread.
Oh, okay.
This is a cannula, not a thread. Okay. Now, let's go back. Hold this a sec. Do that needle again. What do you think so far?
No, I love the jaw.
Isn't it awesome?
Yeah, I can totally tell.
Okay, lay back one sec. Lay back one sec. I'm very impatient. You're very impatient. She's like, what does it look like? I have a needle in my face. Okay, so now we're gonna go down her jawline. We already did now that lateral border.
How long will
We're
this
just gonna
last?
fine tune. Usually about up to a year, 9 months to 12 months, plus or minus, at optimal correction, you guys. So what that means is if you go to the doctor and you need 5 syringes, but you only get 1, that 1 is not gonna last. You need 5. Unfortunately, I mean, we're doing a couple here to really build out her jawline.
And do you draw back when using the cannula?
No, you
No.
can't draw back with a cannula. It's impossible. It's impossible to do. It would suction the skin like a liposuction. Basically done.
People are asking, how do I look like her?
You can go to her website. She can send you tips. You can sign up for the monthly newsletter.
Looks so
It
good.
does. It
Looks so
really
good.
It looks really
I can,
good.
that looks amazing. The
I
difference
know.
is actually weird. I didn't think I was going to tell a difference. Nasty.
Told you.
Can you tell that?
Yeah, it looks
It looks really great.
It looks so good.
bomb.
All right, bomb.
Jawline.
Now, hold on, just
You're so
fine
funny.
tune. And what's awesome about this, you guys, is very little bruising and swelling because we're using the cannulas. A little harder to do, but worth the time, worth the wait.
You want to tell them how like this side of my jaw was like a little uneven?
Yeah, and that's the thing. Most people have one side that's usually a little uneven compared to the other. And by doing this, we can really even it out. Yeah, I love that. Look.
Beautiful.
Perfection.
Thank
so
you.
now, let's do a very
Really, so good.
You should see. I wish you
Oh
could
my
see
god,
it from my
so
angle.
good! It's like Olivia Colbo's jawline.
You got it. You got it. So now we're gonna switch and we're gonna go to just supporting the cheek. We're not gonna build the cheek at all. We're just gonna support it by doing a little bit right into.
This has gone down a bit now.
It's gonna go down. I promise.
Yeah.
It's gonna go down. So I think it's the lighting.
Gorgeous.
Okay, lay back a little bit. I'm just gonna do one little bit.
One
It's
little
very,
bit.
very small. This is a subtle trick, you guys. Let me show you what I mean. This area right here caves in a little bit as we age, and it depresses, making the mouth look a little bit, the upper lip look a little longer, and making the cheek fall down. So by giving some support into the deep area under the nose, here, so it's gonna feel weird, and go right under here into the bone. Just give a little lift right there. It's just gonna lift, it's gonna keep her lip up, and it's gonna support her under eye and her cheek area. Even though we're not really injecting filler there. We're all the way on the bone. Perfect.
That was good.
Okay?
Yep.
That little bit there. Now, let's go to the other side. Let's do that same thing. Actually, I'm really tired. Let's end the day. Half the
Do one
face is
side.
done. Now I'm going to come onto this side, and we're going to do very, very little. Okay, lay on back. It's going to look great. I'm not going to let anything bad happen, okay? And remember, the good thing about these fillers, you guys, the sugar-based fillers, is you can reverse them if you don't like them. And they're easily reversible. But what's great about this product, and I know a lot of people are going to want to get information about it, is it's very different than any other product that we have currently. Because it's pre-hydrated and it's very smooth. Very, very smooth. And even here, where she already has cheeks and we're just trying to get some lateral lift, we're just using it.
Is it possible to augment the chin as well as for men?
Yes, we can. Totally can. I think for her, she already has a nice prominence there.
People are confused of how you're typing and injecting at the same time. Because I'm talking to people on
I have the
this.
Jason Emer social media team.
He's got a crew.
Okay, look all the way up a little bit and turn to the right a little bit. Perfect. So we're going to go to the angle of the jaw on this side. Great. And you know, a lot of doctors, you'll see these things online where they go like this, and do tons of injection points. You can do that way that people are just bruised and swollen for a longer period. So what we're trying to do is prevent that swelling. Good.
And will this build collagen over time?
You know, a lot of studies show it. I do not believe that the sugar-based fillers do that. I think Bellafill, Sculpting, and Radiesse, which are the semi-permanent fillers, do. I just don't truly believe that the sugar-based fillers do that. Okay, we go down a little bit more anteriorly. And grab that one. Perfect, and the last one. See that? Just getting that really tight right along there. Just building that so it just pops. Everything pops.
You know what's so funny is I never think about my lower half of my face as being like a point of beauty.
I know.
I don't think
know.
most people think like cheekbones and eyes.
I know. But they don't realize that it all comes together,
Yeah.
you know? And that's what facial contouring is. Turn, so here's what I'm gonna do. I'm gonna comb, see if I can sneak. Oh wow, which I can. We have a million people here, but we can do it. Okay. Now I'll look up again, turn your head a little right. So we're gonna go for here.
Oh, somebody says hi, Ashley.
Hi.
See how happy she is? now we're going to do that same injection point, but the importance here, you guys, is that we're always feeling for the edge of that jaw. So if you see right back here, I have my finger right at the edge of the jaw. So I'm going to build out that portion of the edge of her jaw. Some women, we want to decrease that depending on their facial shape. And some women, we really want to define it. Perfect. Just want to do a little bit to that
What are you responding to?
nose area.
I'm like, we're getting a lot of compliments.
What are people saying?
Well, they're saying, we're dope, you're beautiful, you're
you.
awesome, everyone in here's awesome, so I think
Yeah,
everybody
people-
watching us is pretty awesome too, so.
So again, that deep area down on the bone, over by the nose, this is not to give volume, this is to give
Yeah.
support to her under her cheek and also just the upper lip. It actually gives support there. All the way down. It's a weird feeling.
It is. It's the one that I feel the most, but not in a bad way.
Got it. And then I'm gonna do, I am gonna kind of go towards the chin slightly, just to get this edge over here, where we were already defining all along the jaw. Look up with your chin for me.
Oh my god, my cousin just chimed in.
Perfect. So, not gonna do anything too wide here, because in women, we want to keep a heart-shaped lower face. Just right along the jaw, I'm just literally walking along, just to balance it right there. Good. Let me see from the front. Just have a little bit more right there. Turn towards me. I'm gonna stay on this side. Go right here. Yeah, that numbing cream gets you really swollen.
Yeah, it really does. That's I always say before I've gotten
It's
my
not-
lips done.
it's
It's
not
like
good.
don't. Yeah.
I
Okay.
know, it's actually hard to do that then. Okay, so you see guys, I'm feeling the jaw, I'm walking right along the jaw bone to give just a little support on the edge of her chin, right here.
That way. I'll not talk.
Thank you. Now,
I'll tell you in a
the
minute.
last part I saved 0.2 for what I call the dab under the eye. Very, very small. Super, super,
What
super,
I'm
super
most scared
small.
about.
I know, but it's literally almost nothing. Almost nothing. It's so little. Just to get it to even out, just to blend, because everyone sometimes gets a little puff there. Look all the way up. Good. Okay. What we're gonna do is we're gonna go really high into the trough. Take a look at where the cannula is. Okay, so you guys can see we're right in the trough. And all I'm gonna do is just a blend, very little. Good. That's it. Okay, I'm gonna come back onto that side, and then we finish.
On a scale of 1 to 10 on the pain scale, how was that? There you go.
Maybe 3. Maybe. Maybe.
3 just because she's crazy,
Yeah.
not because she actually has.
No, like I would say.
She's
it
just
was-
nervous.
Just
you
nervous.
guys. She's very
1 or 2.
nervous. Okay, and I
I
think that's
am.
an important thing to point out. It is okay to be nervous when you have cosmetic procedures. It's just important you trust somebody, which is hard to do. But once you find it, that person, you trust them a little bit. Okay.
Okay.
And you can see where the cannula is,
Mm-hmm.
right into the trough. Very little. Let's see if it's still open. Or not. No. It's okay. Perfect. Okay, so take a look, everybody. She's a little swollen from the lidocaine,
Totally.
but
And
contouring
red.
of her jaw.
Sorry guys, I'm so red.
A little lifting laterally, support at the edge of the nasolabial folds, and a dab under the eye and on the chin. And
last
then
but not
lastly,
least-
she has a little area where she had too much filler placed by somebody else.
Yeah.
So we're gonna inject, point that out right there.
here,
And see this little puff,
It was an acne scar,
this little baby puff.
and they overfilled
And
it.
you can feel it. There's like a little bump there.
Mhm.
So we're just gonna go right into there, 2, 3, and just inject a little Vitrace to get rid of it. That's hyaluronidase, and that's an enzyme that attracts only the pH of filler. It does not attack the hyaluronic acid in your skin. So let's show you. Take a look. At least to start with the lidocaine swelling, what do you think?
It looks very good.
Looks really nice, right?
Yeah.
I think it
Are you
does.
happy?
Yeah.
Honestly, it's
You
gonna
look
be
Gorgeous.
perfect. You look good.
Thank
you. look
you.
really, really good.
Yeah, I can't wait to put some makeup on.
So makeup, so ice packs, anti-inflammatory light, red light, and time. And then she's gonna be perfect for TV and everything, okay?
Yeah, I can definitely tell. with
Yeah, it's
the
way
look
better.
here.
It's
It
way
is way better.
Alright you guys, thanks for tuning in. We have more to come with our newest filler Versa.